As the country battles with the COVID-19 pandemic, persons with underlying ailments have found it rough to cope. With September being the World Sickle Cell Awareness Month, the emergence of the pandemic has given the need for awareness more urgency. Health experts have cautioned that COVID-19 in itself can cause severe inflammation and injury to the lungs. This can take a greater toll if one has sickle cell disease, which is a group of inherited red blood cell disorders.
This time we're talking about COVID-19 as an additional risk for them developing a crisis, because any infection, not just COVID-19, in a sickle cell disease carrier, you're dealing with an issue of someone who's already partially immunocompromised, or their immune system is not as robust as a normal person.
For you to have full-blown sickle cell, we call it full-blown sickle cell, that is HBSS. It means your mother is a carrier and your father is a carrier. And that is the only way now you get sickle cell disease.
My dad knew he had the gene, and my mom also, they knew from their side of the family they had the gene. So when my sister and we started getting sick, like we were tested and found that we had the SS trait.
The symptoms and complications of the sickle cell disease are different from each person and can range from mild to severe. The symptoms of sickle cell disease include abdominal pain, bone pain, shortness of breath, delayed growth, fatigue, fever, and chest pain.
They end up with accumulation of something called bile in their system, which is a resultant of breakdown of protein. So you'll find they have yellowing of the skin, of the the white part of the eye, the conjunctiva, and in very severe cases, even producing very yellowed urine or very dark urine. Okay. So when we talk about the symptoms, so when we talk about the pain, if it's chest pain, your patient will come in really bad pain, and most of the time they will always be on some form of painkillers on and off to deal with the crisis.
Our signs don't necessarily have to be in your body. So like it could be like something small like excitement. Personally for me, when I get too excited, too nervous, too anything, I know. And then you get like two small headaches, a small pinch in your arm, in your leg. You just know definitely you're going into a crisis.
You can't do things like the other children. So you should be like, there are things you are limited to doing, like you can't play, you can't go to cold, because back then when I was feeling cold, my joints will ache.
Doctors say due to the impact of the disease, other infections may emerge on people living with sickle cell.
When we talk about pain, we look at the body organs that can be involved. So one of the most common is the lungs, so chest pain. Some could be spleen. The spleen is the organ that now one acts as a part of your defense, produces the white blood cells that fight infections. But if there's blockage within blood going to the spleen ends up unable to carry out its functions, so producing those white blood cells and also shrinking or becoming smaller.
In 2011, I remember I had the worst crisis, and I almost lost my life twice in like a month. So I was ill. I had terrible bouts of pneumonia. After 2 days, I couldn't walk. I couldn't recognize myself. My body was shutting down.
It is saddening that during this time of COVID-19, some persons living with sickle cell disease are not able to buy their routine medicine, and many other families are choosing to skip medications due to their high costs. Yet their lives depend on the very medication something that poses a challenge to manage the life-threatening ailment.
It is tough when someone calls you in the middle of the night and they tell you, I'm in pain, I don't have medication, and I don't have money to even go to hospital.
The meds, going to the hospital, that's expensive.
And when you're younger, it's even more difficult because crises come too often.
September is Sickle Cell Awareness Month. And this year, we wanted to make a big difference in lives of people living with sickle cell disease because they've had challenges even just to feed themselves because of the COVID pandemic.
Joan Chazima, who has founded the Joan Chazima Sickle Cell Foundation, calls on medical practitioners to focus their attention on the need for research and treatment of the sickle cell disease.
We need to do more. We need to train more health workers on how to manage people living with the condition because sometimes it gets difficult when you go to hospital and they cannot even manage you properly.
We'd also look at things like taxation on drugs and things like that that make it much friendlier for the patient who will have to use these medications for their life.
The good news, however, is that bone marrow transplant may cure the disease. Otherwise, treatment of the disease focuses on the symptom management.
With sickle cell disease, it's just basically how you manage yourself. You can avoid so many other things if you do the right things.
Because it's an inherited disorder, this is something you will have to live with your whole life. So we don't talk about it being treated per se, but more of being managed. And then we treat like when you're dealing with issues of dehydration, so we can treat dehydration or deal with dehydration. Infections we would treat or normally use maybe antibiotics. Then there's the most marked manifestation called anemia, when your red blood cells are broken down so much that the ability to carry oxygen is a bit compromised. So in some cases, we may transfuse the patient, may add blood, so that the carrying capacity of blood of carrying oxygen is enhanced. But we shy from that because of something called iron overload.
This month's theme, dubbed Sickle Cell Matters, is geared to create awareness about sickle cell and to garner hope for the people living with the ailment. Faith Imani Mugo for Hope TV Newswatch.